Welcome to Live with Hillsdale Hospital. Today is Wednesday, June 11th, and we're here to bring you all of our patients, our families, our friends, the latest and up-to-date information about healthcare right here in Hillsdale County. And today I'm in the studio, joined once again by Lauren Schneider. You've been here a few times. We had an opportunity last week to be on the radio to talk a little bit about some of the exciting things that are happening in surgery. And there's so much going on in surgery, Lauren, that I thought, you know what, we've got to do this. We won't spend a whole great deal of time discussing all of the intricacies involved in the OR, but I do want to highlight some very important things that are happening. So just so our listeners know, and you've shared before, but give us a little background of yourself. You're a recipient of one of our scholarships, correct?
Yep.
And I believe you had a relative that encouraged you potentially to get into healthcare, but tell us your story, your background, what you do for surgery. And then I want to jump in to share with our listeners, some for the first time, some exciting things that are happening right here at the hospital.
Of course. So I'm Lauren Schneider. I have been a nurse here at Hillsdale Hospital for about 9 years now. As JJ said, I was a recipient of the tuition assistance scholarship.
And that's at a time where we paid it all, right?
Yeah.
So, I mean, we covered every...
don't age me, but yes, that was...
We covered every expense, except for books. And
yes,
I think,
correct.
Did you... And so you went... Where did you go?
I finished at Jackson College.
Okay.
Yeah.
So you stayed home?
Yes.
Commuted?
Yep.
So you didn't have those costs, but
correct.
Tuition all covered.
Yes.
Graduated, and then what was your first job?
I worked on med-surg for about 2 years
Right.
before I went down to the surgery department as a circulating nurse. Did that for about 4 years, and the last 2 years I have been manager of surgery department.
Doing a fantastic job. So did you know when you transferred from med-surg, like that was your home? When you went to surgery, like this is where I want to be?
I'll be honest, at first, no.
Yeah, okay.
Like,
It's good.
It's a big shell
It
shock.
is. It is.
But now it is my home. I'm kind of biased. We have a great group of people.
It's a great group of people.
Fun area to work. So
and you have a lot of partnerships. So we have anesthesia, which we utilize CRNAs. Jason Flowers and his group, Challenge Anesthesia, they do a great job.
Yes, they do.
Could not have surgery, obviously, without anesthesia.
Correct.
Then you have support staff. So you have a tremendous amount of staff ranging from RMs to scrub techs. Why don't you talk a little bit about the diversity of that group? You have sterile processors. Talk about those positions, because surgery isn't just about nurses. I mean, it takes the CRNAs and it takes pre-admission testing. Talk to us a little bit about your team. I think you have a phenomenal team. I know you do. Let's brag about them a little bit.
Yeah. So a lot of the people in the surgery department are kind of behind the scenes.
They are.
So I don't think, it takes anywhere from about like 30 to 35 people a day to run the surgery department. So we have anybody from our surgery scheduler to pre-admission testing. We have pre-op, post-op, circulating nurses, our scrub techs, which is probably one of the coolest jobs.
Yeah, that's cool.
Ever.
Yeah, I hear that.
So they're the ones right in there with the doctors, handing them the instruments. And then we also have sterile processing, which is another behind the scenes. People don't know much about it. They are, without them, we also could not do surgery. They're the ones who sterilize the instruments, make sure we have what we need.
And that's a major operation.
Yes.
We have huge machines that we spend a lot of money on, and then staffing, of course, to make sure that the instruments are ready. But then beyond that, Lauren, there's vendors who bring us, products.
Yes.
Because we utilize a whole array of supplies and equipment to do the surgical procedures.
Right.
So you have vendors for joint replacement. You have vendors for urology. The list goes on and on.
Yes.
And you have to maintain those relationships with those vendors.
Correct.
I think that's what's important.
Yeah.
Now, the other area is you've been down there now, how many, 5 years? 6 years? 7 years? Is it 7?
7.
All right. So see, that's right. 7 years. And it's changed a lot in surgery.
It really has.
From when you first started.
Yeah.
In fact, the whole premise of surgery in our country has shifted from inpatient, have the procedure, you're booked in for 3 days, to now outpatient.
Correct.
And I would say the majority of our surgical interventions are outpatient.
Yeah.
Would you agree with that?
Yeah.
Talk to us about what would qualify an individual from being discharged same day or outpatient versus a requirement to stay in the hospital, because that I remember a joint replacement for my father 25 years ago.
Mhm.
He was here for a whole week.
Yeah.
Now it's outpatient.
Now,
So talk to us about the changes. And do you see that as a good thing? Or talk to us a little bit about that.
I do. Yeah. So a lot of it depends on what the surgery is. We can go into the, depending on insurance and whatnot. And
It's true.
there's a lot of different factors that go on behind the scenes before we make the decision. But someone who would go home after surgery, say it is a joint replacement, we would make sure that they have the physical therapy evaluation before they leave. Like we do kind of like an expedited, recovery process that one would normally see on the inpatient side, but we do that all in recovery.
Right.
Yeah.
So let's talk a little bit about, you got all these functions. You have recovery, you have recovery nurses, right? But before the patient even gets in the door, let's talk a little bit about that.
Yeah.
Because the primary care or the specialty surgeon will refer them, primary care will refer them to specialty. Specialty will then schedule the surgery.
Yes.
And then it just isn't that the office is telling me you have to be at the hospital at 5 o'clock.
Right.
There's a process involved with that, right?
Yes.
Because some patients don't qualify to even have the surgery if there's conditions, correct?
Correct.
Talk to us a little bit about how the process works and once I know I need surgery to actually getting the surgery.
Yeah, so once your surgeon says that you need surgery, they'll coordinate with someone in their office to do check with insurance, make sure if they need a prior authorization for the surgery, that is completed before they schedule the surgery.
Right.
So we don't want to schedule the surgery and say, yeah, you're going to have this if your insurance says, oh, hold on, I need X, Y, and Z before we can move forward.
And we've denied people, unfortunately, because the insurance companies will stop it.
Yeah.
And we've even had situations where same day we had to cancel surgery.
Yeah.
Because the insurance did not have the authorization ready, correct?
Correct.
And that's a process in and of itself.
Yes. Yeah.
Some surgeries can take even weeks to get prior approval, correct?
Correct.
Depending on the patient's acuity and what the surgery is. All right, so take us through the rest then.
Yeah, so the surgery scheduler within the office would call the hospital surgery scheduler to coordinate a date for surgery. And then once that's set, our surgery scheduler, her name's Sandy, she's phenomenal.
Yeah, she is.
She would contact the patient with their surgery date. And then schedule a pre-admission testing appointment.
Right.
So that is with our pre-admission testing nurse, go over health history, medications.
So then what's the advance time on that? Nurse is going to call them a few days in advance, a day in advance?
It's typically a week, 7 to 10 days before the surgery.
So 7 to 10 days before the surgery, a nurse is calling them on the phone,
Correct.
having a conversation about, first of all, their medical history. Would something in that medical history preclude them from getting the opportunity to have the surgery, you think? Has there ever been a denial based on filling out the forms that are required?
Yeah, so with the health history that our pre-admission testing nurse gets, if there, a red flag comes about, she will contact anesthesia and consult them.
Okay.
So,
and anesthesia may say that's too high risk of a patient.
Correct. Yeah.
It's rare though,
happened.
right?
Yep.
It's rare.
And usually the doctors will communicate with anesthesia as well, even before boarding a patient if they have a complex health history.
Right.
But yes, that has happened where anesthesia has been brought in. They might have different recommendations on how to proceed with the anesthetic. But it is really a team effort.
It is.
To get a patient scheduled.
Right. And prep. So let's talk about, the dreaded colonoscopies, right? Yeah. So it's important that patients follow the recommended prep before surgery. Your nurse is telling them most likely that the day of surgery, take XYZ pills, don't drink water, those type of things.
Correct.
How important is that?
It's very important. I mean, we will unfortunately have to cancel surgeries if someone ate or drank.
Yeah.
And I think one thing that people don't realize is that the nothing by mouth includes chewing gum, chewing tobacco, anything that kind of stimulates that, your saliva glands to, think that you're eating it. Still has that same sort of reaction. So puts you at the same risk as if they were to eat.
Yeah.
So
do you find people that are surprised that when they do eat and then they come in and they tell you they ate that you have to cancel the surgery?
Yeah.
I mean, they're just surprised about that. Yeah. And have you ever had a situation in which the surgeon, is engaging in the surgery and then did realize that the patient did eat, and now we can't do the surgery. You get much of that?
Not really.
Not really.
No. It's really important to be upfront about that because the risk for aspiration
Yes.
when you go under is,
So that's critical.
Yeah.
Communication.
Yeah.
So then that's pre-op. Post-op. What
Yes.
happens post-op? So before I can get discharged from the hospital, what has to happen?
So we keep you in the first phase of recovery. So right after you wake up from anesthesia for about 30 minutes. We usually don't let family members come back at that time just because it is a critical, like 1-to-1 nurse to patient ratio or 1-to-2 nurse to patient ratio. But then after that 30 minutes, as long as you're comfortable, no nausea, family can come back. Most surgeries, we love you to eat and drink.
Yeah.
And then most surgeries, depending on what it was, you have to pee before you can go.
So we call that
eat, drink, and pee. Or
EDP. All right.
Yep.
EDP. Got to make sure you do that.
Yeah.
And that is then the catalyst for allowing them to be discharged and to leave.
Correct.
Let's talk a little bit before we get into the specific surgeries, and I'm excited to share a couple of new procedures we're going to be doing and offering new providers. So post-surgical complications are common in some cases, right? Because whether the surgical intervention didn't work or there were issues, it's really important, and I think it's important to impress upon our listeners, to communicate with your provider post-surgical, right?
Yeah.
So the importance of that is if you had any fallout or complications or suffering any type of pain or any of those things. You want to talk a little bit about that?
Yeah,
Like,
sure.
what would be the catalyst for that?
Yeah. So prior to discharge, one of our nurses will go over discharge instructions, which includes a list of complications, side effects that you might experience, and when to make that call to the doctor. So leaving the hospital, you kind of have an idea of what to be looking for. But if you experience, a fever, pain that's not controlled with pain medications, excessive bleeding, or we say foul smelling drainage from the incision, you'll want to let your doctor know. But of course, if it's something life-threatening, emergent, go to the ER.
Yes. All right. So Lauren, I'm excited because you have built the surgery program into a beautiful, beautiful place. It's very busy.
Yes.
We are extremely busy. We brought on new providers. We're offering surgical intervention and services that rural hospitals just simply aren't offering across the country. And you go to seminars and they probably look at you like they do me when I go to places and speak and say, how are you doing that in rural America today? How do you attract a neurosurgeon? How do you attract a urologist to the community? I'm sure you're hearing that too. But we have grown this. Before we talk about some of those exciting specialty services, I do want to talk about general surgery because general surgery is a lot of what a category that a lot of patients fall into. General surgery, talk to us about what is it? What does it encompass? Is it everything from A to Z? Are there certain specialties? Give us a sense of what general surgery does. And then we're going to get into the specifics of specialty services.
Yeah, so general surgery, I mean, you can go to the general surgeon for various reasons, but we do a lot of like hernia repairs, gallbladders, even as far as like bowel surgeries, breast surgeries. So if someone has a suspicious lump in their breast and they need that removed, we'll do a breast biopsy. And then they also do pacemakers. Yeah,
that's something that's important to talk about, right? Because you often think that only a cardiologist is in, but that's not the case at all. In fact, it's usually general surgery that does it. There's a misnomer that it's cardiologists that do it. But our general surgeons, both of them do pacemakers.
Correct.
So Dr. March, Dr. Morgan, both insert pacemakers at the recommendation of obviously your cardiologist and communication. And they've both been trained in this area, correct? And they both engaged in those already. And Dr. Morgan's already done some?
Yes, he has.
So pacemakers. We also have a new technique coming out that I understand is for incontinence.
Correct.
What is that called and who's doing that?
Yep. So Dr. Morgan will be doing, we call them PNEs.
Okay.
So peripheral nerve evaluation. It's a 2-part procedure. The first part is the evaluation. It works with the nerves for incontinence. So bowel or bladder incontinence.
Okay.
So I know it's something that people don't really like to talk about,
Right.
but it is out there. I mean, people do
Yeah.
suffer with this, and there are treatment options.
And some of them become shut in, immobile. They don't want to move because they understand that there could be an accident out as they're at an event. This has restored confidence in people's lives.
Yes.
This is how important it is.
Yeah.
So they do the P&E, which is a test.
Yes.
And if they qualify for the surgical intervention, what does that look like?
Yep. Then they would have the implant then placed.
And this implant, do you know much about it or not a whole
We
lot?
have done a few of them
Yeah.
with our urology group. So urology can also offer this. So, I mean, our patients have seen great results.
Great results. And if I want to do this, can I go directly to general surgery? Do I have to get a consult typically? Should I see a urologist? What are your thoughts?
It probably depends on insurance, what your insurance requires.
Okay. But our general surgeons and our urologists can do that.
Both
So
do.
urology is Dr. Stockall,
Yep.
general surgeons March and Morgan.
Yep.
They're able to engage in these procedures, correct? All right, so that's kind of general surgery.
Yeah.
What I want to focus on now is some of the other exciting things that are happening in the OR. We've expanded quite a bit in the last 2 years. We have been able to bring a relationship with urology, which has been very, very effective and great. We're doing kidney stone removals. We've got some new technology even in urology that we're utilizing. It was first in the country to utilize that, filling them, and very excited about, being that place that people can come and train. Beyond urology, then we started to expand in other areas. Vascular surgery.
Yeah.
So what can I get done with vascular surgery? What types of intervention are we seeing?
So Dr. Alam is our vascular surgeon. So if you have if you need a thrombectomy, so if there's a thrombus, obstructing the blood flow in your legs, all the way to an aneurysm repair. So I think one of the coolest things we do with him is what's called an EVAR.
I think it's incredible.
So
Talk about it. Because
really great.
my colleagues across the country, are telling me that in small rural hospitals, no one's doing this.
Yeah.
And we're able to do it.
Yeah.
So it's endovascular aneurysm repair.
Correct.
Let's talk a little bit about what that does.
Yeah. So if there's if you have an aortic aneurysm, they're just 2 small incisions in the groin that they go in. It's this big graft that they put in that goes over the aneurysm to prevent it from expanding or anything happening to it. So patients do stay the night after that procedure,
right.
But typically can go home within a day or two. And I know we've had great results.
And we have done
quite a few of them.
Dozens, maybe?
Yeah,
maybe 20?
I would say pushing 20.
20 of those, which again, for a rural hospital like ours to do, thank God for Dr. Alam and the hard work that he has, put forward in establishing a practice in Hillsdale at Three Meadows, and then engaging in surgical intervention here. It's one thing to have a practice, which some can do, but then it's another to do the surgeries here. Some vascular surgeons say, no, we're taking you to XYZ.
Yeah.
We can do it right here with your trained staff. That's incredible. Yes. All right, so we've got urology, we've got vascular, then we start getting into ENT. So we have Dr. Mucha.
Yep.
No, now she's pediatric ENT. So but we don't do children here, correct? Or are we doing some of the children?
We do some of the children,
All
yes.
right.
So depending on what the case is,
Okay.
a lot of ear tubes. So if your kid has frequent ear infections,
for those types of things. But generally speaking, anesthesia for major cases, Dr. Mucha would take those potentially somewhere else if they're major cases.
I would say I'm not
Not
exactly
for
sure
Okay.
the age,
Right.
but I think for tonsils and adenoids, around 5.
Around 5. Okay.
is
All right.
Where
So that's
she
kind of
would
the cutoff
determine.
where beyond that. Okay.
Yep.
So then ENT, adult and pediatric.
Mhm.
She's here, I think, in surgery once a month.
Once a month.
And then in her clinic, she has out at Three Meadows is periodic, and that is posted, I believe, on our website. But there's an opportunity to have ENT, ear, nose, throat. So now we've got all these specialties. Then I wake up one day and it's like, you know what? We could really use some neurosurgery here. But no one in their right mind is hiring neurosurgeons in rural hospitals because the payer mix is so difficult with Medicaid payments not covering even a fraction of the cost of neurosurgery. But we stumbled on a great opportunity. Dr. Loganathan, talk to us about him. What type of procedures is he doing? And give us a little teaser maybe about what's coming in January.
Yeah. So Dr. Loganathan has been with us since I think December of 23, I want to say.
It's
It's been
actually
over-
pushing the
yeah.
second year.
Yeah. So, and he is phenomenal
Incredible.
to work with. He's great with his patients.
Yeah.
Very personalized care with each patient
Yeah.
that he has.
Yeah.
And so he does lumbar fusion, cervical fusions, discectomies.
Yeah.
Pretty much, I mean,
They describe it to me from basically neck to ankle.
Yeah.
I mean, and
Yeah.
everything in between
Yeah.
is what can be done.
Yep.
And he is so busy that
Mhm.
he's booked out months, which is incredible.
Yes.
He came from Jackson. He had a strong practice in Jackson. Now he's got a strong presence in Hillsdale.
Mhm.
But he's here full time, right?
Correct.
And what happens January 1?
Starting January 1, he will be an employee of Hillsdale
Isn't that
Hospital.
awesome?
Yeah.
So he'll
very
now be
exciting.
employed, engaged with us, working
Mhm.
closely with we'll see nurse practitioner or PA. We'll find that out in the future. Stronger practice
Mhm.
presence out at Three Meadows, but engaged in a lot of surgical interventions.
Yes.
Neurosurgery right here at Hillsdale Hospital.
Yes.
Vascular surgery, aneurysm repairs. You can have your neurosurgery here.
Mhm.
We've got, you can have your urology appointments that can go to addressing your kidney stones and having those taken care of here. This is pretty awesome what we're able to do. Let's not forget about some of the old main stables here. We've got orthopedics.
Mhm.
Talk to us a little bit about what we see in orthopedics right now.
Yeah, we do a lot of joint replacements, total joint replacements, shoulders, knees, hips.
Yeah.
And we have Dr. Hannah and Dr. Carr doing those procedures. And then we also do, shoulder scopes, knee scopes,
Yeah, a lot of scopes.
fractures, and pretty much any sort of fracture we repair.
And then at their clinic, so the
Mhm.
orthopedic clinic, we've got Ken Rubin.
Mhm.
And Ken spends a lot of his time in there. We have other providers as well, but Ken is someone who's been known to the branch and Hillsdale areas for decades.
Mhm.
And the advanced practice providers, we just hired a new one,
Mhm.
and she'll be coming from Coldwater area. And we were able to get the clinic up to a point where we can get the appointments sooner than 3 or 4 months, because a lot of the complaints I was hearing in the community is, JJ, we'd like to use your services, but we call and it's months to get in.
Yeah.
We've cleaned that up.
Mhm.
Accessibility is a key. So having access to those providers.
Mhm.
But then we also have a relationship with another orthopedic surgeon, Dr. Ekbo.
Yes.
Talk a little bit about what he does and why is that different than what we do?
Yeah, so Dr. Ekpo, he comes to us once a month to do just strictly total joint replacements, knees and hips.
Yeah.
So he's bringing us patients from outside of the Hillsdale area to have their surgery done here. Usually they're a little more complex.
They are complex cases.
Patients.
Isn't that incredible that we're saying in 2025 that Hillsdale is boarding the most complex cases that surgeons are now bringing us from other hospitals?
Yeah.
Is that incredible?
Yes, it is.
It's amazing to see the growth.
Mhm.
And, Lauren, that's a testament to the work that you've done and the hard work of your team. I mean, you have
Yes,
a great
for sure.
team. You do a phenomenal job as our leader, but also underneath your tutelage
Mhm.
and leadership are some great people that you've been able, Jamie,
Yeah.
Thompson, Jamie now is Gadwood,
Yes.
recently married, so
Yes.
Jamie Gadwood, and the whole team, that have really just come together to make sure that our surgical services are superior.
Mhm.
And we really are operating this in respect to like a surgery center.
Mhm.
And that's incredible. When you have providers like Dr. Alam who are coming to us to utilize our OR, we're not employing Dr. Alam,
Mhm.
but he utilizes our services and we have a relationship with him in that capacity. It's incredible to watch.
Yes.
One other area before we wrap up, podiatry.
Uh-huh.
So
Yes.
Dr. Bidney retired,
Mhm.
and we knew that we had to fill a gap. So talk to us a little bit about what we see in podiatry and what type of cases do we see in surgery with podiatry.
Yeah. So we're very excited to onboard and introduce Dr. Patel, Dr. Kamal Patel.
Yes, yes, not Dr. Patel, the orthopedic surgeon.
Yes.
Right.
So she will be operating on Fridays in the OR.
Yeah.
Still kind of working through the kinks of, what exactly she'll be doing there.
Yeah.
But we're very excited to take care of our
Yeah.
community because it's definitely a need in our community.
Yeah, and she'll have a relationship, excuse me, with wound care.
Mhm.
So that's good. Talk to us a little bit about what surgical growth looks like for you.
Yeah, so my ultimate goal is to continue to expand not only our service lines, but the types of procedures that each specialty does. And then I would love to expand the hours so we can continue to serve our community.
Yeah, and expanding those services, we're also looking at some new service lines.
Mhm.
We're not going to talk about it just yet, but we're looking at some new procedures, even
Mhm.
talking about plastics
Mhm.
and some things. General surgery does some plastics,
Mhm.
but what could Hillsdale look like? So if you have an idea, a
Mhm.
suggestion, what you would like to see right here at Hillsdale, maybe you are going to a surgery center, maybe you're going to a specialist. You say, you know what? I don't like to travel an hour and a half, 2 hours. Drop us a line on our Facebook, on this feed right here. Send me an email. You can contact us at hillsdalehospital.com. You can find it says connect with CEO on that website. Send me some information about what you would like to see here in Hillsdale County brought to our own hospital to utilize these services. And I think about beyond, what we were able to do with anesthesia. We got PET scan here now. We've got an amazing radiology department that's just incredible. We have support services. This is a real deal.
Yeah.
And I'm so excited about the work that's been done. Congratulations to you and your team. We'll be announcing some exciting things in the very near future. But having Dr. Loganathan here as a neurosurgeon, having Dr. Alam here as a vascular surgeon, Dr. Stockall, all these providers, Dr. Ekbo, and then our existing members who have been faithful and loyal to us through the years. It's just great to see the team come together. You're busy down in surgery. It's just a hop in place. Thank you for the great work you've done.
Of course.
Before we close, are there any questions about? We've answered them all. That's great. Well, thank you to our listener. Thank you for tuning in and supporting the services at Hillsdale Hospital the way you support them, not just by listening to programs like this, but also utilizing our services. That's so critical. If you're thinking to yourself, well, bigger's better, we go to the University of X or we go down to X hospital, bigger is not better. It isn't. We statistically and we have quality metrics that demonstrate just the opposite of that we give personalized attention right here in rural hospitals. And we have some of the best quality scores, low pricing compared to our competitors, and in a community that you know and trust and faces that you see and trust. There's nothing more challenging or daunting than taking a loved one, as I have, to a university hospital. You don't know one person. They're all in their own worlds. They're walking around looking at the ground. Here, we have the 10-5 rule. We're engaging people. We're smiling because we genuinely care. But in order for this hospital to remain propped up and continuing another 110 years of service, we need your support. And the way that you do that is utilize these services. So if there's one service that you think we should have that we don't, let me know. If there's a service that's not meeting your expectation or at the par level that you think it should be, let me know. We want to hear from you as we look at specialty services. Dr. McCants is retiring. We have Dr. Morgan and Dr. March that can pick up some of those services, but we're also looking at what other services do we need to bring in to Hillsdale. So all of that revolves around you utilizing our services and entrusting us to give you the care that you and your family need. So if you're looking to join a winning hospital and a winning team of employment, right here it is. Top hospitals, top nursing home. We've been named that on numerous occasions and probably, hopefully very soon can announce something very special about that again. But if you're looking for an opportunity to have a career, go to hillsdalehospital.com under the career tab. We have like 40 job openings. It's an incredible place to work. You've been here 9 years. I've been here 16 now. It's incredible to watch what has happened over that span of time. Third largest employer in the county, second largest in the city. This is a happening place. Great opportunity for you to connect and to receive education beyond just whatever your interest is. So if you say, you know what, I'm interested in coming into the lab and working, but one day I want to be a nurse. Ta-da! One day we've raised individuals up from working in the dietary department and in laundry, and now they're doing nursing services. And so we'll sponsor that. That's the opportunity that you have when you join a winning team like Hillsdale Hospital. If you're looking to volunteer, we need volunteers. They're so important. and integral to the operation of this hospital. They support us in laundry and the gift shop and getting packets out, information, delivering things on the floor. We are living in a time right now where, as I go around the country and hear stories, volunteers are just, they're drying up, they're dissipating across the country. And we could use some volunteers. If you're interested, go to our website. There's an opportunity there. Come in, stop by the gift shop. That's where there's applications for volunteers. We'd love to have you volunteer as well. So employment, volunteer, and then, there's the other area, donations. If you're interested in making a donation, we're tax exempt. So the opportunity for you is to give to a nonprofit. It's right here. We're just like any other nonprofit. We do encourage individuals to give to us to reinvest in our building and our services. We'd love to be able to receive any donation that you have. And you can even earmark that donation for a particular service, for a particular piece of a device, or even equipment. And we've had individuals do that in the past. So look forward to seeing you here again next week. You can always catch us every week on WCSR every Friday, Saturday. We're on Buzz Radio. You can hear the same program that's on WCSR 92.1 on Fridays. And then, of course, these opportunities for live events are opportunities to bring you new and exciting things that are happening. And then every week, Rural Health Today, our national podcast, ruralhealthtoday.com. You can, wherever you get your podcasts, download Rural Health Today, subscribe, and you can listen to what's happening across the country to rural health. So until next week, stay safe, stay healthy, and stay Hillsdale strong when you choose Hillsdale first. Thanks for joining us.